one going to be?
More than 55 million people have contracted COVID-19 globally. More than 1.3 million have died. And as infection rates surge, governments are imposing measures hoping to buy time until a vaccine is approved for use. A number of vaccine candidates are now in the works in Europe.
A few days after our contract with BioNTech and Pfizer, I'm happy to announce a new agreement. If the vaccine has proven safe and effective against COVID-19, every member state will receive the vaccine at the same time, on a pro rata basis, and under the same conditions.
European governments are particularly worried about the alarming rise in infections. The 5 countries there reporting most cases are France, Spain, United Kingdom, and Italy. The European Centre for Disease Prevention and Control is an agency with a mandate to strengthen Europe's defenses against infectious diseases. But there are many who question its purpose. Critics say the agency has not been effective in dealing with this crisis. And without any executive powers, its recommendations are not legally binding. So, how will the agency convince its member states for a more unified approach to the COVID-19 pandemic? The director of the European Centre for Disease Prevention and Control, Dr. Andrea Ammon, talks to Al Jazeera. Head of the European Centre for Disease Control and Prevention, Dr. Andrea Ammon, thank you for talking to Al Jazeera.
Hello.
Dr. Ammon, what exactly is the ECDC's role when it comes to containment and when it comes to controlling the coronavirus pandemic?
So our principal mandate is assessing risk, identifying them, and also communicating our analysis and assessments. So our role is basically assessing risk, providing options for the member states to respond to.
Dr. Ammon, is Europe seeing a second wave of coronavirus right now, or is this just the continuation of the first wave that was paused during the lockdowns that happened in spring?
Well, this is a philosophical argument that people are having. Fact is that we are seeing now since 4 months an increase in case notifications after the rigorous measures in March and April have reduced the case numbers by 80% during summer. So the virus was never gone. We always had cases.
What are the factors that have led to Europe being in the state that it's in right now when it comes to the coronavirus?
The measures that have been introduced in March and April were very strict. And after they have been eased, I believe there were a bit, people were a bit too happy and enthusiastic in meeting again, and then the virus took the opportunity and cases started to appear again.
Dr. Ammon, the European Commission has been pushing for a more unified approach to combating the pandemic. What would you like to see happen?
For us, what is currently making it most difficult to compare the situation between the countries is the different approaches to testing, for instance. And although we have rolled out protocols as to the approach to testing in the countries, countries have the responsibility to choose their ways themselves out of the options that we provide. And so countries have chosen different paths, leading to different denominators from which the figures that we are comparing come from. And that would be, in our opinion, something where we would see a progress if countries could agree to a common approach.
Do you believe that a more vigorous test and trace system will be put in place to try and control the coronavirus going forward?
since many months, countries in the EU have actually beefed up their testing capacities and the contact tracing capacities. And we said that this is an element that has to be put in place all the time, regardless how many other measures are present, because that is one of the basics that allows you to see and get a good overview of the situation, but also to evaluate whether the measures that are put in place or eased, whether they have an effect.
With much of the EU now in lockdown again, lockdown fatigue is once again setting in. Do lockdowns actually work? I mean, if other measures aren't in place, won't infection rates just rise again once the lockdowns are over?
I mean, the what we have seen in March and April was actually a very good effect of the packages of measures that have been put in place. The infectious, the case notifications have decreased by 80% after these measures were put in place. Now, besides the good effect on the case numbers, these measures, of course, have also an effect on the economy and on the society. So it was now the aim of health authorities to find ways how to balance the two. So keeping the case numbers at bay, but still allowing some life in society and the economy.
Dr. Ammon, what is the position of the ECDC when it comes to the issue of school closures?
We have said very clearly that although not everything is known yet about the role of children in transmission, it seems that they are not a major driver of infection. So we said that if certain measures are put in place in schools, that it is very important that children get actually educated and go to schools. So we consider that the advantages outweigh the risks when certain measures are put in place.
Brussels is going to sign a deal to secure up to 300 million doses of Pfizer and BioNTech's experimental coronavirus vaccine. This is a vaccine that has shown thus far promising results. When is the soonest that you think this vaccine could start appearing in parts of Europe? When do you think vaccinations could take place, and how will it be distributed?
This is very difficult to say. The trials are, for some of the vaccines, in their final stages, but still not concluded. And it's very difficult to say when the vaccines will be available. Regarding the distribution, it's very clear that at the beginning, the amount of doses will be limited, and so that prioritization, prioritized groups in the population have to be defined, and that is what we are working right now on with the technical advisory committees in the countries.
Dr. Ammon, will a vaccine that prevents COVID-19 be able to stop the spread of the virus?
That is one of the elements that is important for a vaccine, that it prevents getting infected and infecting someone else. But it is also a question how effective the vaccine is, meaning which percentage of the ones that are actually vaccinated are also protected. And these are figures that we don't know yet.
There is a lot of vaccine hesitancy. There is a lot of anti-vaccine sentiment in the world right now, in parts of Europe. What are the challenges that lie ahead for you and the ECDC in ensuring that you can educate the public in Europe that a vaccine would be safe?
One thing that we know from the surveys is that there are two factors that are most concerning for the population, and that is the safety of the vaccine and the effectiveness. So we are now working with our colleagues from the European Medicines Agency to put a system in place for monitoring the safety and the effectiveness of these vaccines as soon as they are actually on the market. And that is to ensure the population that these two aspects are closely monitored. Also, our colleagues in the Medicines Agency are reassuring that they will not compromise the safety of the vaccine compared to the speed of the authorization.
There are critics of the ECDC who question the purpose of the ECDC. They say that the ECDC was specifically created in order to be able to tackle a crisis like the COVID-19 pandemic, but that it has not been effective in dealing with the crisis. What do you say to that?
It depends on what the expectations were compared to the mandate that we have been given. What I have seen sometimes is that the expectations towards us were far outside the legal mandate that we have been provided with. And that, of course, then can lead to, disappointments in the expectations if they go beyond what we have been basically permitted in the legal base to do.
So the ECDC doesn't have any executive powers. Your recommendations, as I understand, are not legally binding. So how can you be sure that countries will follow your advice?
We cannot be sure. We can only ensure that we have a close contact to the colleagues in the countries, that we are open to their questions, that we consult them in preparing our guidance so that it is not a priori infeasible for them. And otherwise, we can only aim at being as convincing scientifically as possible.
Do you believe that ECDC advice needs to be officially adopted across the EU bloc to be effective in the fight against COVID-19? In other words, if they're not listening to you, are they going to be effective in the fight against the pandemic?
Well, there are elements in our advice where it's more crucial that every country does it than for other elements, and there is also the fact that the epidemiological situation is not the same in all the countries. Even within a country, there are sometimes differences. So there is also a need for adaptation of measures according to the local or sub-national epidemiological situation.
What is the top of the list for you when it comes to priorities, the priorities being listed by the ECDC for the EU? And are those recommendations being listened to at this stage?
Can I just ask you priorities for COVID or in general for infectious diseases?
Priorities right now for COVID, and then if you could also answer priorities also for infectious diseases, other infectious diseases.
Okay, so for COVID, what we need to do now is to ensure that we can monitor in the winter influenza and COVID simultaneously, because both viruses may circulate, and we have to keep track of both of them, both in the population and in hospitals. And the second part is that we need now to prepare for the vaccine. Then it's a third priority that we now need to really learn lessons and prevent the third wave of COVID when we now come over the peak of the current wave.
Let me ask you this. How is the latest rise in infections in Europe different from the first? Is it a more virulent form of the virus, or are people just less compliant when it comes to the recommendations?
I think in the first rise that we saw in July and August was mainly due to intensified testing. And we could see this that the population were in the age groups of the cases notified in these months were different than in March and April. So we had more cases with non-severe disease, and only now in September, October, since this period, it starts also to get in the older age groups again, the hospitalizations rise and the deaths rise.
Dr. Ammon, let me ask you specifically about the logistics of potential vaccine coordination and distribution. How challenging will that be? I mean, do you believe that that is going to go smoothly in the various countries, or do you think there are serious logistical problems going forward?
Well, we don't know yet which of the vaccines will be licensed, but we know that some of the vaccines will require 2 doses. So logistically, this will require a good system of recall. Those who had received the first dose, that you make sure they get the second dose and are fully immunized. So that is a logistical requirement. And then we know that at least one of the vaccines has a requirement that none of those existing vaccines has, that it requires storage with a minus 70 degrees. But in the end, it will depend on which of these vaccines will be licensed and on the market. Definitely, it is something that countries need now to think about how they would organize campaigns.
And do you think that the countries are actually thinking about this? Are they going ahead from now and looking at the challenges of distribution, or is this something that's going to be dealt with later?
Well, the thing is, I believe certain scenarios are discussed.
Dr. Ramon, let me ask you, did Europe, in your opinion, miss the boat when it came to containing the coronavirus when the first cases were discovered in Europe and confirmed in January?
Well, you have to see that retrospectively, you assess situations differently because we know now much more than we knew in February and beginning of March. Retrospectively, at the situation in February, at least before the rise started in Italy, we had very few cases. But that were very few cases that we knew about and that were detected, because I am sure now that we had many more cases actually already in the population that were not tested for, because the testing rationale was targeted towards returning travelers.
I'm going to ask you to expand on that a little bit more, because I want to ask you about the fact that in late February, the ECDC said there was only a low to moderate chance that COVID-19 would spread across Europe, that governments in Europe had solid preparedness plans and adequate testing capacity, and that was at a time when case numbers were spiking in Italy. Why make an assessment like that at that particular time?
Okay, so regarding the laboratory assessment, that was made after we did a survey where the member states replied to us what kind of capacities they had. That was done beginning of February, and was geared towards the fact that each country had the possibility to diagnose the virus. What turned out to be the case was that the laboratory material, the testing kits, there was a shortage, but at that time that was not considered in the replies. So that's the one thing. Regarding the preparedness, we do not have the possibility to check each member state on their preparedness unless they invite us. So we had to rely on the feedback from the member states when we have actually started asking them in January. regarding looking at their preparedness plans, and they have said they have looked at their preparedness plans and so forth. So again, there is a discrepancy between what is expected from us and what we can actually do.
Where are things now when it comes to the cooperation of member states, when it comes to member states allowing the ECDC to look at their preparedness plans, coordinating with the ECDC, making sure things go forward in a smoother manner?
We have right now, I think our colleagues in the member states are quite busy with dealing with their epidemics. But we have an understanding that we would like to actually do in-action reviews with the countries. We have published a protocol for this already in July, so that those who would like to learn lessons to improve now already during the pandemic can do this, and we have offered them support.
Dr. Ammon, how much do your budgetary constraints hamper the ability of your team to do the kind of work that's necessary to perhaps more effectively combat COVID-19?
I mean, right now, it's not the budgetary constraints, it's the staffing constraints that sets our limits.
I mean, where do you need to be when it comes to staffing that you would feel that you would be able to more effectively combat COVID-19, and where are you now?
Well, we have right now 280 statutory staff, and any increase will be part of the negotiation that will now take place in the coming weeks and months.
Dr. Ammon, there's been animal-to-human transmission in Denmark at mink farms. How concerned does Europe need to be about this development?
We have published a risk assessment on this, and Denmark is only one of the countries where these transmissions have occurred. There's still a number of investigations that need to be done.
Dr. Ammon, starting on November 23rd, Spain is going to be demanding a negative PCR test to be taken within 72 hours of travelers going to Spain. In the case of European countries and those in the Schengen area, Spain is going to rely on the ECDC risk map. Is the ECDC ready to take on this responsibility?
Well, the map that we have is based on the numbers that the countries are reporting to us, and I think there was an agreement how to scale the maps, how to color the different categories of case notifications, and that is what we publish. What decisions the member states base on this is their responsibility to take.
Is it frustrating to you, if I can verge into a little bit of a personal question here, is it frustrating to you to be hampered in not having more authority when it comes to trying to get EU member states to really take on these recommendations from you and your team?
When I took up the post here, I knew what the mandate would be. So that is nothing that has surprised me. This is what we can do. We do what the best with the means that we have. And we are committed to provide the best available evidence so that the decision makers in the countries have the best basis to make their decisions.
Do you believe that member states are being fully transparent with the data they're providing you with?
I have no reason to think otherwise.
What are the biggest factors from your point of view as far as when it comes to the spread of coronavirus now? What are the biggest reasons why the spread continues?
I think one of the things is that either the measures that have been put in place are not effective, or they are not completely complied with. And second is that the testing and contact tracing can still be further developed.
Final question for me. How much longer do you believe society is going to be living with coronavirus?
I believe this virus will not disappear. The question is how we will adapt to the virus over time. The question will be what additional value vaccines can provide. I know there is also research going on for a specific medicine against COVID. So the way how we will have to live with the virus will depend on all these factors.
Head of the European Center for Disease Control and Prevention, Dr. Andrea Ammon, thank you for talking to Al Jazeera.
My pleasure.